No matter how old you are or how long you've smoked, quitting can help you live a longer, healthier lifestyle. With some tips to help smokers kick the habit is Dr. Meredith Maxwell. Thanks so much for joining us.
Of course.
You know, it's for folks out there who smoke, I guess it's easier said than done to kick the habit because it's something that you feel that you have to need.
It is discouraging if you've tried over and over again and tried to quit, but you have to want it. You have to be mentally ready. Nobody could make you do it, or you're just going to quit, gets discouraged, and push it back. So you got to know about that first and foremost.
Well, here's some incentives. Tell us about the risk and what happens to you when you smoke. Okay,
so your blood pressure immediately and long term goes up. Your heart rate immediately and long term goes up. Your pump function to your heart goes down. The buildup of cholesterol goes up. The dangers of secondhand smoke to your kids are phenomenal. They can get more asthma, sudden infant death syndrome, more ear infections. You know, there is more deaths from secondhand smoke, about 37,000 per year. Just from people like smelling the smoke of other smokers. I mean, this is crazy.
So if you live in a house with someone who smokes, if you're a parent and you have children around and you're smoking, these things are affecting them just as they are affecting you.
Exactly. So maybe that might be some motivation, not just for yourself and your health, but for your loved ones around you.
So what do? I mean, there's several smoking cessation programs. There's gum, there are patches. What's the thing that you've seen working better for maybe your patients?
So from my point of view, multi-faceted approach. There's 1-800-QUIT now that can send you text messages and support things in like a kind of a club type atmosphere and tips and tricks. Medication it has been very successful. It can decrease your enjoyment of the medication. It can decrease the withdrawal effects.
So it'll actually make you not like the taste of smoking.
Exactly.
And you get that through a doctor.
Exactly.
Okay.
A lot of things are over the counter, but if you failed some of these things, there are other options. It's like trying on shoes. Something that works for somebody might not necessarily work for you, but you know, keep at it, keep trying, figure out like the things that have worked in the past and the things that haven't. Write those down. Write down motivational tips that you can read over and over again when you're trying to quit.
Yeah, for some people it's something as simple as the gum, the nicotine gum that helps them just not take that cigarette. When you first stop, it's not going to be easy street. People experience all sorts of anger and withdrawals. It's almost like a drug addiction ending.
It is, and there's lots of things you can do to mitigate that. You can gain weight, which is people's biggest fear, but you can always take that off later. The health risks involved are much, much, much greater. Depression, anger, irritability, those are all things that can come from it. And if the symptoms are too great, talk to your doctor. We can really help you. You just have to be mentally prepared and mentally ready to quit.
And ready to have more years tacked onto your life.
Exactly, and not hurt those around you.
All right, Dr. Meredith Maxwell, thank you so much.